Thank you, Presiding Officer. To ask the Scottish Government what investment is making in the Scottish Ambulance Service ahead of the West of Scotland trauma network being launched.
Cabinet Secretary.
By the end of 2019-20, we will have invested £33.4 million in the Scottish Trauma Network, which includes the Scottish Ambulance Service, with funding planned to increase to 41.6 annually by 2023-24. From this investment to date, the SAS Trauma Desk, based at the Glasgow Ambulance Control Centre, is operational 24/7, playing a vital role in the coordination of services in response to trauma, with additional investment in major trauma equipment across the service's emergency vehicle fleet.
Stuart McMillan.
I thank the Cabinet Secretary for that reply. And at a recent Community Council meeting in my constituency, where senior staff from Inverclyde Royal Hospital spoke about the West of Scotland Trauma Network, there were concerns raised by constituents about the impact on local ambulance provision. Can the Cabinet Secretary provide assurances to my constituents that the Scottish Ambulance Service will be able to meet the needs of the local community when the trauma network is launched, and it will not result in slow response times in Inverclyde, particularly when ambulances do have to take people up to Paisley and Glasgow?
Cabinet Secretary.
I'm grateful to Mr McMillan for that supplementary. I do understand that those concerns will arise in this instance. However, the ambulance service is really clear of our expectation that they give consideration to the impact of any changes where additional demands are placed on their capacity. They're currently undertaking a national review of demand and capacity, which will include the anticipated demand on them from the West of Scotland Trauma Network, as they're using their experience from elsewhere in Scotland, where we have the trauma centres now in Aberdeen and in Dundee. That review of demand and capacity will help them ensure that they are able to meet all the demands, and they will bring from that their requirements of the health service in terms of additional resources and where those resources need to be deployed. So we are committed to supporting them in this work and to considering very seriously the outcome of their national review of demand and capacity, taking account of all the factors we've outlined.
Question.